Some common risk factors of periodontal disease that you need to be aware of. And I really like this visual because for me, I'm a very visual person, and this helps me to get a sense for what it is that I'm going to be dealing with and looking at and what I need to be aware of. So not only does it give you, kind of what it looks like just by looking at a patient, but I like this animation next to it because it allows us to see what happens to the gum tissue, to the bone, as it's going through these various stages of periodontitis. So what are some of those common risk factors that we need to be aware of? Smoking is one of them. We know that it wreaks havoc on our body, and it also does damage to our tissue and our bone as well in our mouth. And it's not just smoking, it's also vaping and also the use of marijuana. There's not enough studies yet on the effects of marijuana and what it has on periodontal disease. But if it's anything like smoking and vaping, we know that there's chemicals that's either within the cigarette or in the vape that is the person is putting in there, and it can do damage to the bone and the tissue. Next one is going to be diabetes. Any type of a medical condition is going to create some issues and problems and can be a risk factor to periodontal disease. And not only that, it's not just a condition, it's also the medication that the patient is taking as a result of that. Poor oral hygiene, we know that to be the case. If you don't brush and floss your teeth, well, this is what's going to happen. It's going to end up like this. Oftentimes, somebody who has is a smoker or a drug user, an alcoholic, has very poor hygiene to begin with, because that's not obviously at the front of their mind of what they have to do is to maintain their teeth. But it could also be maybe people that have some sort of a medical condition that doesn't allow them to have the dexterity that they need to be able to hold a toothbrush properly or to be able to floss their teeth like they should. So poor hygiene, we know to definitely be a risk factor. Osteoporosis. Osteoporosis is a condition that results in the deterioration of the bones, and the same thing happens with our mouth as well. And not only that, but again, not just the condition, but the medications that the patients are taking to sort of help or prevent the osteoporosis from getting any worse. Stress, we know that stress causes a lot of issues with our body altogether, and our mouth is no exception. Oftentimes, if we're under a little bit more stress, we start to find that our tissue, it might start to bleed when we're brushing or flossing. It might get irritated. It might get red. So it's kind of that beginning stages of gingivitis. So stress can actually, do a lot of damage to our mouth if we let that stress kind of get to us, especially now with what we're dealing with COVID-19 pandemic and possibly people losing their jobs, or now parents having to homeschool their kids as well as working and trying to create that balance. You might have noticed that your gum tissue might not be as healthy as maybe it was prior to this whole ordeal happening. So making sure you're maintaining your stress levels, not just for your oral health, but for the overall health of our bodies is important. Again, medications, talked a little bit about that, but we know that medications often leads to xerostomia or dry mouth, which can, it's the loss of saliva production, which can cause damage to the tissue and the bone. HIV and AIDS is anybody that suffers from any kind of an immunocompromised immune system, they're going to be more prone to getting other diseases, and periodontal disease is unfortunately one of those things that comes along with having HIV or AIDS. And then local factors such as dental work and appliances. If the dental work is faulty, if it's failed for some reason, if the patient is not maintaining the dental work properly, especially if it's like a crown, because if you remember, a crown fits over the entire portion of the tooth. And if the patient's not taking care of that with brushing and flossing, then bone and periodontal disease can begin to occur. People that wear partials because it sits on the tissue, especially if they're not taking it out to clean it and allow their tissue to breathe, then it can start to lead to possibly some periodontal disease. And what we know, especially when we're looking at the severe periodontitis down here, I mean, we can clearly see a lot of bone loss going on. There's not much holding in these four anterior teeth here. So unfortunately for this patient may end up losing these teeth as a result of the severe periodontitis. But we're hoping to catch our patients in this stage. And even in this stage, we can't get our patients any better than this, but we can certainly maintain these bone levels where they are so that they don't get any worse and patient starts losing teeth. But definitely here in the gingivitis stage, we can certainly get our patients back to looking like this and being healthy. So important for you to understand what those risk factors are and maybe some things to talk to your patients about.